Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Lynn McComas. She's a nurse practitioner and she's the founder of PreceptorLink. Today's KevinMD article is The Future of Healthcare Depends on Hands-on Training. We cannot afford to cut corners. Lynn, welcome to the show.
Thank you so much. I appreciate it. And I appreciate you letting me have the opportunity to be on your show and to share your forum with nurse practitioners and PAs and other clinicians. So thank you for that.
All right. So let's start by briefly sharing your story and journey.
Yes. So I started many years ago. I was an RN and I actually was even a travel nurse way back when, long before it was popular. I got my master's of nursing as an adult geriatric nurse practitioner, and this was more than 2 decades ago. And most of my clinical practice as a nurse practitioner was in primary care, and I love being with adults and geriatric patients, so that was my specialty. And then later, I got my doctorate in nursing practice, or DNP, from Duke University. Go Blue Devils! In North Carolina. And one of the reasons I did that was to help become a change maker within my profession as a nurse practitioner. So I'm one of those people who tends to get involved and hold leadership positions. And I've held a lot of different leadership positions in many different types of NP organizations. And so I did this, and I was in our local chapter meetings in San Diego. And I started seeing more and more students come in looking for preceptors. And the NPs at the dinner meetings would look out the window and down at their plates and weren't interested in precepting. And I thought, gosh, I've had a lot of hats in my years as a clinician, as a mentor, as a preceptor, as now a business owner, but at the time I wasn't. And I know how much work it takes to precept. And I thought if we could simplify the process, streamline things, and even offer a little honorarium, that people might be more willing to precept. And so I started the business, and that's how it was founded a decade ago.
All right. And for those who aren't familiar with medical training in general, what exactly goes into precepting? What are the responsibilities of nurse practitioners who want to precept students?
So it's a little bit individual for the preceptor and also the schools, different schools. There are basic requirements that are required from the organizing bodies, but also the schools can have different requirements. So the minimum current is 500 hours of clinical hours for a student. The preceptor typically has different rotations, or the student typically has different rotations that they have to do with different preceptors and different specialties. It really depends on what area their program is within. If it's psych, they would have to do different types of psych rotations. Family, they'd have to do different types of family rotations. And the preceptor needs to be able to mentor the student for anywhere from typically 8 weeks to 12 weeks of ideally hands-on, where they're progressing them from maybe a few hours or a day of observation, but gradually progressing the student to having hands-on, because that is just the most important critical part of the learning process, is for the student to be able to progress to the point where they are seeing the patient with on their own, with obviously the preceptor overseeing things. But that's how it typically works. And it depends if it's acute care or psych or primary care or the different settings. Each one is a little bit different, but the ultimate goal is to help a student progress from minimal observation to hands-on in a safe environment.
And your KevinMD article, of course, talks about that, and we'll go into that in more detail. It's titled The Future of Healthcare Depends on Hands-on Training. We cannot afford to cut corners. So tell us the events that led you to write this article in the first place, and then talk about the article itself for those who didn't get a chance to read it.
Yeah, thank you. So the article really came from a growing frustration that I've had with opportunities for hands-on training decreasing in clinical settings. We're starting to hear from sites where students are really limited to their hands-on training, and they're being told they can just observe. And really, obviously, that's not ideal. And so when I received this particular message from one of our really beloved preceptors who started a new job and was willing to take a student. It just and the HR person forbid anything other than observation. I just knew that I had to speak up. And the article is not just about NP students. This also pertains to PAs and med students, because really this is starting to happen across the profession. And it has broader implications for safety and for the quality of future health care. And so writing it was truly an attempt to bring awareness and advocate for change.
Mm-hmm.
That we can't just focus on productivity and financials and liability concerns with students, because we jeopardize the development of educating the next generation. And ultimately, that puts increased liability risk on future clinicians after they've graduated. So it's really becomes a vicious circle.
And when you get those emails from HR people and medical organizations, are the reasons because of liability and financial and productivity? What are the reasons that they're giving you?
Well, most often they don't give reasons, but when we have dug into it with them, yes, it is, they're concerned about productivity, slowing down the preceptor. They're worried about liability. In this case, it sounded like it was more a concern about liability. And so they have just eliminated the opportunity for hands-on at all. It's solely observational.
And for nurse practitioner students and PA students and medical students in general, if they run into these roadblocks where more and more medical institutions are saying no and just allowing shadowing, what are the opportunity? What are the options available to them when they come to that point?
Well, I mean, you can, it just depends. I mean, it's most often in my world, we would replace, because that's not useful. It might be useful for a very small thing or for a very specialized thing or for a short period of time, but true observation is not ideal. They really need to get their hands on and advance to, progressing with, taking care of the student. So sometimes we have to replace, or sometimes we have to see if that is acceptable for the student in school. So it just depends.
So are you finding that it's because of the HR people at these institutions themselves as a limiting factor? Are you finding nurse practitioners themselves are a little bit hesitant to be preceptors? You mentioned that meeting where that was asked and they just kind of looked down at their plates. Are you seeing hesitance from preceptors themselves, whether they're PAs, physicians, or nurse practitioners, or do you think it's just an edict that's coming from above from their HR people?
No, we actually see both. So sometimes
Okay.
the preceptors themselves are the ones, because we do have preceptors that they own their own practice. And whether it's an NP, a physician, a PA, whoever the preceptor is, sometimes they are the ones that are saying observation only. I think we're seeing this more in psych, where there's more telepsych, and it's a sensitive issue. I mean, I understand that, because psych is something that's so deep and personal, and the patient's opening up about themselves, and so it can be a difficult situation. But we're seeing it in both institutions and within the preceptors themselves.
Now, let's talk about more in detail about the broader implications of this. And you, of course, alluded to that earlier. So the fact that these students are finding it more difficult to get hands-on training, talk about how that's going to jeopardize their education going forward.
Yes. So as mentioned, they're not going to be comfortable if all they've done is observation. They're not going to be comfortable or prepared as clinicians in the real world environment. So if they haven't done hands-on and listened to heart sounds or done a pap smear, how in the world, when they have graduated, can they possibly be prepared to be a quality clinician?
So, what are some of the answers here? Because it sounds like this is just another aspect of the business infiltrating healthcare, right? Everyone's kind of worried about their productivity. And as you said, precepting takes time out of their day, reduces productivity. What are some of the solutions going forward? Because the infiltration of business in medicine isn't going to abate anytime soon.
Right. So I really think that it's up to the individuals and our profession to advocate. We have to advocate. And one of the best times we can do this is if you are negotiating for a new job. If you want to precept, that's the time to bring it up, get it in writing, get it in your contract, and ask for the ability to be able to precept, make sure that they understand that when you say precept, you mean hands-on, because it is something that is needed for the advancement of our profession. And get it in writing. And then when you're also the other thing is that we should all advocate just for change, for this positive change. This should not be something that institutionally is considered the norm. We can't do that. We can't do that as professionals. We can't have non-hands-on. It's just going to backfire in the long run. So I think we all need to advocate for this change within all professions, all medical professions.
Tell us about some of the rewards of mentoring or precepting students.
Well, it helps keep you up to date on some of the current literature. Sometimes students may even have some of the more recent information that we don't have our hands on, and they may have recent research studies and protocols and things like that. It really does help keep you on your toes. And most of us in the medical world, we like to teach, we like to share our knowledge. So it's very rewarding to see someone progress and to be able to help them progress in their fields. And then, of course, in some institutions are allowing preceptors to receive an honorarium, to receive payment. So that's always nice. So other things that you can get that, again, you can negotiate for is library privileges, adjunct faculty status, different things like that. So think about what you might be able to ask for when you are being asked to precept, because there are things more than just honorariums and payment and a coffee mug. So sometimes you can get a little something extra for precepting. And really, it's also everybody we need to help educate the next generation.
And how about our professional societies, certainly in the nurse practitioner world that you're very familiar with? What kind of initiatives or advocacy or policy efforts are being advanced from a professional society standpoint?
I am not aware of what is being advocated from a professional society basis. All I can answer that is my own personal experience.
And for those students looking for a preceptor, what kind of advice do you have for them?
So if hopefully their school is helping them, it's always good to do your research ahead of time and try to find a school that does help. But even if they do, sometimes you don't end up getting the place you want, or the type of preceptor is not the location. So, dig in, use your networks, use your LinkedIn and every contact you have. Get your resume buffed up, make it professional, and you have a cover letter that's directed towards the particular rotation that you want. And it's basically like a job interview when you're looking for a preceptor. Take it seriously. It's very competitive out there, and you need to put your absolute best foot forward. And if you need to, we are here to help.
And in terms of current trends, what do you foresee in the next year or so when it comes to these students finding preceptors? Are you hopeful that there's going to be a turnaround, or do you see that the number of willing or able preceptors continuing to decline?
Well, I wouldn't say that the number of willing and able preceptors is declining, because we get new preceptors all the time, and we lose preceptors all the time. It's just a normal attrition process. So I wouldn't say that there's fewer preceptors. Sometimes there's challenges and headaches that go along with finding a preceptor. But there's some things that I hope will help. I actually do hope that nursing will start incorporating more AI. I think there is potential there. I would love to see more virtual reality used within nursing as far as precepting goes, not in lieu of, but as an adjunct for preclinical. I think there's so much potential. If you can imagine having a virtual reality as your pap smears and pelvics the first few times, it helps to make it so much more comfortable when you go in to see Mrs. Smith in room 1 and she's your first real hands-on. So I would love to see that happen more. And we'll see, hopefully it does. So, other things that, I do hope that the profession will do more with this. They will take it on more and help students find preceptors. It really ideally should be something that the profession is doing. And I feel terrible for these poor students. This is something that I took on out of what I felt was necessity, because students that were really struggling to find preceptors. But hopefully, as time goes by, the profession will step up more to help with this difficult and burdensome task.
We're talking to Lynn McComas. She's a nurse practitioner and she's the founder of PreceptorLink. Today's KevinMD article is "The Future of Healthcare Depends on Hands-on Training. We Cannot Afford to Cut Corners." Lynn will end with some of your take-home messages that you want to leave with the KevinMD audience.
Yeah, thank you. I would say that please do advocate for hands-on education, and advocate for preceptor education too. We all need to have, if we have more preceptor education within the different institutions and within the profession, that does help the hesitant and the novice preceptor to be more willing to precept. So thank you so much for letting me have a voice and an opportunity to share. And let's get the next generation of preceptors educated.
Lynn, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.